the campus. Can you give some examples of those and how they've improved security or not?
Yes, I have a lot of notes here. There's been so many things that have happened here at the hospital. Certainly some things that come to mind. The rekeying of the perimeter, the awareness of teaching staff to what to be on the watch for. There is a lot of contraband coming in and out of this hospital. There's a lot, these buildings are old, many of these buildings are old. We've seen what's happened before with escapes and things like that, which so paying attention, having security guards and environment of care rounds, going around looking, examining, checking the windows, the doors. There is a lot of opportunity to use things in these buildings as weapons. Those weapons hurt staff, they hurt other patients. I'm thinking of anti-ligature. One of the things that the hospital is always very, very concerned with, Joe, is the issue around patients who may be suicidal and the opportunities they have to harm themselves here in the hospital. That is under constant observation, and much of that has to do with the physical plant. And again, in your press packets is a long list of many things: rekeying doors, changing 1,200 faucets. The list is just endless.
Does the governor's budget, assuming it goes through, which it probably won't, but,
Come on, John. Sunny day here. Don't spoil this.
but if the governor's budget goes through, does that fix all the problems, or is there another lineup of problems that you would have to tackle in the 2019 to 2021 biennium?
I think that, as science improves, the governor's budget tackles them at their fundamental level. The ability, as he says, to discharge patients who are simply waiting for a place to go. The governor's budget absolutely addresses that. It addresses it with the community mental health center partners. It addresses it with diverting patients who can be better served in the community and don't even need to come to West State Hospital. Beyond that, we know mental illness is on the rise. We know that in terms of chemical dependency, substance abuse is on the rise. We have an opiate crisis in this country, combined with other things, major mental illness. There will always be a need for our services, so we have to stay on top of this. Does it fix everything? It is a very, very, very good start to fixing everything.
We got one more question.
If CMS came back tomorrow, how confident are you that you would comply with the systems and improvement agreement?
That is a difficult question to answer right now. Our consultants are here on site. We've been here since June. They are currently running tracers. They are auditing charts. They are looking at environment of care, safety. They are looking at things, you heard some of those today in your packet, around our ability to increase active treatment by 11,000 patient hours on weekends and evenings. Those are huge successes. It has taken the hospital a long time to get here, and we are being asked to turn it around in 13 months. So I do not want to take a guess at that. I expect them here anytime between today and the middle of June. So we just keep moving at lightning speed. Every inch is alive here at this hospital, working towards that mean. So we are trying very hard to do that.
In your own estimation,
I
how
want
far
to add
along are you?
something to her. The one thing I can tell you, which is almost a virtual guarantee, if the legislature, if the Republican budget were to go through and knock the props out from underneath this hospital, it's going to be decertified. There's going to be no way this hospital is going to maintain certification long term if it goes back to the staffing pattern that led to its collapse. That's a lead pipe cinch, and that's why we need to get the legislature to listen to this issue.
All right, thanks,
What
guys.
two things did you notice?
By the way,
Thank
Mr.
you.
Murphy is security. If you want to ask about security issues, he's your guy. Thanks, Cheryl. Thank you.
Thank you, sir. Governor, thank you.
Yeah, keep working.
We're working hard, sir.